Hi, my name's Ashley Ashbacher and this is my Tube Passoff. So first thing, I'm going to pull up the record and see that we need to do an NG tube placement today, so I'm going to gather my supplies. So I'm gathering my NG tube, all of the chuck, pH, tape, all of those things, make sure I've got it there. I've got water for him to sip on while we place it, hand hygiene, gloves, we should be good. So we're gonna go ahead and take our supplies to the patient's room. Knock, knock, knock. Hi there, my name's Ashley. I'm your nurse for today. How are you doing? Good. Can you just verify your name for me? Thank you. And what is your date of birth? Perfect, I appreciate that. I do see that it matches our armband there. So I heard that we have some stomach pressure going on, and so we've been ordered to do an NG tube for you today. Yeah, I know it's gonna be not the happiest procedure, but it's definitely gonna make you feel better when it's done. So I'll just try to work with you and communicate with you, and we can go at each other's pace, okay? All right, so let's get you all prepared here. So to start, let's get you sitting up if that's okay. And I have closed the door, or I pull a curtain if that was a thing. So we want to get into a high Fowler's position so that you can sit up. My patient can sit. So I'm just going to make sure that you're comfortable here. Bed rails are up, bed is locked. So I'm going to go ahead and get some gloves on here. And we'll just get you all prepped. All right, so we're gonna get this chuck and we're gonna place it on your clothing just to protect it. So we'll tuck that in, is that okay? Perfect. All right, so we're doing that. I'm gonna go ahead and place this bed rail now down so that we can just have easier access. You're at a good working height for me. So we're gonna go ahead and measure first. So this is our NG tube. I'm gonna get it here. And this is our little piece that will hook up to suction later, so we don't want to lose that, so we'll put it in this bin to keep it safe. And then we're gonna go ahead and measure before we start. So what I'll do is I'll measure from your nose to your ear, and then we're gonna measure down to your xiphoid process, which, yep, you can feel it right there. Okay, perfect. So I've got that at just over 50, so I'm gonna mark it with my marker, which is hiding over here. We mark it so that we know where to insert it when we're putting it in. So we've got that marked, and now we can go ahead and begin inserting this. So we've got some lubricant here for the tip of it. I'm just gonna open that and throw it in my garbage can. So first thing we're gonna do is we're gonna have you tip your head back. I'm gonna just help you support that. Real quick, we have to decide which side we should put it on first. So if you can, go ahead and just tell me which side is easier for you to breathe out of. And breathe. And breathe. Perfect. Okay, so we'll insert it on this side. Thank you. So tipping the head back, if you begin to gag or have any issues, we'll watch the pace that we're going at, and we'll stop if you're starting to turn blue or you can't talk, if you feel like we're in a lung or something like that, okay? Perfect. And before I get this in here, I'm actually gonna give you a tissue. There you go, and I'm gonna give you some water. When we tilt your head forward, I'd like you to sip on this. Just sometimes that makes it go down a little bit easier. So I think we're ready to begin. So we can go ahead, tip back, and we're gonna go in here along the nasal floor. You're doing great. and it looks like he's starting to gag a little, so we're gonna have you lean your head forward, and this is where I'd like you to sip on that water, and sip, and sip. You're doing great, thank you. Keep going, your coloring is looking good. I don't see any signs of an issue. Perfect. All right, and we have inserted it to that mark. So go ahead and relax, take a breath. You can hum and sing, you can talk. Perfect. Okay, so now I'm gonna go ahead and I've got it at the mark there. I can mark it again if needed. I have it marked as I'm seeing. So I'm gonna go ahead and hold it here for a second, and I'm just gonna get it attached to your cheek. So we could get the tape, and what you should do when you're setting up your supplies is actually get your tape ready when you start, so that you don't have to worry about, you know, your patient sneezing out the tube or something. You don't have to let it go, and also it's just usually easier when you have two hands when you're working with tape, especially in this situation when it's stubborn. But we'll go ahead and just get a little piece here. Perfect. And then we're gonna go ahead and just tape it to your cheek for a minute. We've got to make sure that it's in the right place. So we'll go ahead, and that is taped down now. We'll take your water. Okay, so we're gonna go ahead and, before we move forward, I'm gonna get my other tape ready really quick. So we're gonna go ahead and just verify its placement really quick. So we're gonna go ahead and put this in, and my tape came off, so we're gonna make sure that it is not moving. The check mark is still there. I'm gonna draw up 30 mLs. Perfect, thank you. Keep this on the chuck. We're gonna put it here. We're gonna get our pH strip, and we're gonna check. It's looking normal to me, but we'll check the pH just to be sure. Perfect. Wow, that looks great. So we verified that it's in the correct spot. You could also do an x-ray to verify as well if that was something that was ordered. So I'm gonna go ahead and just get my gloves changed, and then we'll get that all secured for you. You're doing awesome. So we'll go ahead and get this attached. Make sure that the black is still marked there. We don't want to do it too tightly against the nose. You can use some nose lubricant if it is ordered, or if your patient prefers that. And then you're also going to want to go ahead and just measure the remaining distance as well, so that you can get that documented. When you're charting, you'll document that you placed the tube at your 52, so that whoever's coming in next, they just know what distance it's at and everything. So now I'm going to go ahead and have my patient look the opposite direction. Great, we want to attach it to the clothing, but we don't want to do it where it's like too tight, so it could be like pulled on or anything. So I like to tape it down. Some patients, especially if it's like a kiddo, you'll tape it to the cheek. And then you can just go ahead and secure the tape that you just put in place. So it's through there, but it's not through your cord, of course. And now with this type of pump, we've got to hook it up to suction above the stomach level. So that's where our little fancy tool will come here. You'll have a valve that would go here. It's the blue to white. We don't have the little blue to white nozzle, but you'd put that on there. Got it. Turn it on a low intermittent suction. You can turn your head forward for me. Perfect. Everything sounds to be working right. So we would go ahead and perform some oral care for you. We'll do that every 2 to 4 hours, just to make sure that nothing is, drying up. You can get an analgesic for like soreness in your throat if you need to, so you can let us know about that. But we would go ahead and just clean up all of our supplies here and chart the measurement that we inserted the NG tube at today, and just make sure that I leave you comfortable and safe. So this, we'd get it down to the ground, hand hygiene. And do you need anything else before I go get this documented? No? Perfect. Everything looks good, so I'll check back on you soon. And we'll go ahead and do that oral care when we come back. Thank you.